Hello, everyone, and welcome to the American Foundation for Suicide Prevention's Elevating Voices for Long-Lasting Change Town Hall series. I'm Dr. Christine Moutier. I serve as AFSP's Chief Medical Officer, and this series brings together experts from the mental health and suicide prevention space to talk about our unique and diverse experiences based on our families of origin, and issues of diversity, equity, and inclusion. The purpose is to really hear about our personal and professional experiences to help the entire community learn, connect, and just come along together as it relates to our own and our families, our community's mental health and suicide prevention. Today's town hall focuses on culture and mental health in South Asian communities. And I am thrilled to be joined by three experts in the field and really looking forward to our conversation today. So I would love for each of them to introduce themselves. And Dimple, let's start with you.
Thank you. My name is Dr. Dimple Patel, and I have my doctorate in clinical psychology and have been working as a therapist. And I currently serve on the board of directors for the American Foundation for Suicide Prevention Illinois chapter and am the co-chair of the DEI committee. And my connection with suicide prevention started with the loss of my mother in 2011 and personally having experienced depression and anxiety since the age of 21. And lastly, I am from the Gujarati community.
Wonderful. Thank you so much. Gila, let's go to you next.
Thank you so much. I'm Gila Kayum. I'm a child and adolescent psychiatrist and also trained in consultation liaison psychiatry. Currently, I'm the training director for the Child Psychiatry Fellowship Program at Boston Children's Hospital. And I'm originally from Pakistan and found myself working a lot in acute psychiatry where I've taken care of a lot of diverse patients, including South Asian patients. And over the course of my career, I've had a few patients die by suicide. And so my area of interest and focus is really the impact on families, trainees, and caregivers, as well as providers and clinicians when a patient dies by suicide.
Thank you so much. And Deepak, let's go to you.
Hi, everybody. I'm Dr. Deep Penisetti. I am a child, adolescent, adult psychiatrist. I specialize in play therapy. I'm one of the chairs at the American Psychiatric Association in the Division of Diversity and Health Equity. And I come from New York City. I trained at the Mount Sinai Triple Board Program, and now I have, a practice and am also an attending physician in New York City's first transition to home unit for the homeless. In addition to being a psychiatrist, I'm a producer, actually. I work a lot in film, television, media, and my mission became to help people who don't make it to an office like mine, because me and my family didn't. And we had some very close calls. And I'm looking forward to this conversation.
That's wonderful. And I just want to recognize that the theme here is about South Asian culture and communities. And we know that South Asian communities represent 8 different countries. Deep, do you want to just speak to that just for a moment before we get deeper into our conversation?
Yeah, absolutely. I always think it's interesting, when you look at a map, and just throwing this up here, when we think about South Asia, we don't realize it's 8 countries. We think of India big in the middle. I'm Indian. I'm actually from South India. So between me and Dr. Dimple Patel, we're North and South representing here, and Pakistan, of course. But you see, there's Nepal, there's Bangladesh. And, I actually like this next slide even more, that just kind of lists out the flags, we don't think about, sometimes the Maldives, Afghanistan, Sri Lanka. This is all part of South Asia. And although there are unique differences in the cultures, obviously, there's also quite a bit of harmony, especially I found in this country. There's a lot of overlap. And so I think this conversation is very relevant to us all.
Okay, excellent. So as you all can see, we have a wonderful panel, and I'm really looking forward to this conversation. Have been looking forward to it for weeks. So Gila, I'd like to start with you and ask everybody to please chime in, really to speak to how the culture within the South Asian community informs the way people and the community think and talk about mental health, and where do you see kind of room for opportunities and how to help individuals and families really optimize our own mental health and our communities.
Thank you so much. I think to Deep's point, the entire South Asian community is very diverse in itself, with many cultural and religious identities, but there's also a shared historic experience of colonialization, trauma that's gone over for generations, and how it's perpetuated the stigma around mental health, that even though we have extended families with very permeable boundaries where there's a lot of back and forth and connectedness, and yet there is also, on the other hand, this sense of shame and immense stigma about talking about mental health, where people just suffer in silence just to make sure they're saving face, they're preserving the family's honor, that we look okay, and we show that to the world, because who knows what would happen if we didn't. And I think that shared sense of stigma and shame has kept people from seeking help for generations. And I think partly there's been a shift where historically families were connected and people were there to support each other. So even if they didn't understand, they still were there to help. And now if we're looking at, South Asians in the United States, that sense of extended community may not be there. And so there is this sense of being alone in your problems, and yet those values, that shame, that stigma has persisted. So I think it's sometimes religion can be protective and sometimes faith is not. For example, they can be the sense of these problems and this suffering is predestined. And there's nothing we can do about it because there's an external locus of control, or it's meant to be this way, or it's a punishment and we must endure it. And how people understand, they may not have the knowledge, they may not have the understanding. And somehow the way we sort of approach our problems is that you first go to your family, and if then they don't have the answer, then you might ask your friends. And then you might look at some religious or spiritual leader before you actually go to a physician who's not from within your community. And I think that's partly like, yes, it's important that we seek help, and yet it's impeded by, I think, structural issues and sort of racial prejudices and people's internalized experience of that. And also there's this sense of like other people won't understand our culture. So how will you ask help from someone who does not have the language, does not have the background, does not have that experience? And on the flip side, there's this fear that if they do understand, are they going to judge us the same way as the rest of the community does? Or will those limits of confidentiality stand or not? So I think it's very multifaceted, and I'd be very interested to see what Dimple and Deep have to say.
I'll just chime in there before you, Dimple, because I think you really bring it to color when you share your story. But remember, I'm a producer. I like to brand things. I call this the Browntown Catch-22. We come from a caste system, so if I share, I bring my whole family down a couple of rungs on the caste system. And if I don't share, people die. It's this really terrible position to be in, and yeah, I just kind of tee that up for you, Dimple, because you're so able to share, and I admire that.
Thank you.
Because we have to,
Yeah, I related to so much of like what everything I said as if it was talking about me. And I always say that my mom and I were both born in the East, but raised in two different cultures. I moved here from India when I was 1, but still raised in a very traditional Indian household. And as many of my friends were as well. And so when I first experienced a panic attack at DePaul University in Chicago in 2009, actually, that's how far back it was. I was 21 years old. I was at college. I didn't really know what was going on with me. Mental health was never talked about in my family, let alone, or if it was, you would hear the word, oh, they're crazy or something's wrong with them. And like their family was talked about. So when I told my mom about like what was going on, she's like, you're fine. Don't tell your dad. And so I became so scared, but I also felt so alone. But I didn't blame them when I went to therapy and understanding a little bit years later that they knew what they were taught by their parents and that generational pattern being passed down. And so fortunately for me, there was counseling services available at my college at a low cost that I went to therapy in secret. And that was the first time I was able to talk to somebody. But the funny part is that, as you guys had mentioned, they asked me if I wanted a South Asian therapist. And my immediate thought was, nope. And they're like, why don't you try it out? And it goes to everything you said of what are they going to say of me? Like they're, in our culture, we respect our elders or are taught to respect our elders. What if I disagree with them? I didn't even know what confidentiality was. I just was so afraid, but it ended up being the best decision for me to work with somebody that understood everything from my cultural background. It made things easier. I didn't have to explain things, but she also validated everything that I felt and also allowed me to think for myself for the first time. Without feeling selfish.
Yeah, I joke around. You see, I make a lot of jokes. I don't know what else to do with life. I always say when I talk to Indian people, they either want an Indian psychiatrist or South Asian psychiatrist or anyone besides a South Asian psychiatrist, and it's different for different people. But I can say, with my work, working with the marginalized. And we talk about this concept of health equity and what's the difference between equity and equality. And those on the margin are disproportionately affected and it's not equitable for these reasons. And I think it's about translating some of all the science that we have, right, at Boston and New York and all these great institutions, but translating it for our culture in a way that I think we kind of need to solve the problem from two angles. Yeah, decrease the stigma, but also be able to have the conversations that we need to have in a way that's comfortable for our community. So this is a
ongoing issue.
Yeah, ongoing. Yeah.
Yeah. Oh, go ahead, Deep.
No, I was going to say, I mean, to tell you the truth, I don't know where to go from there, but I'll just say maybe it's a good kind of segue into talking about, I don't know, some of what I've experienced is, there's this concept of the model minority myth, and the model minority myth is a myth. Here, I'm going to pull up another slide while I'm talking about this. And I think it's been like perpetuated. And the origins of it were kind of like flattering. They were, trying to talk about the Japanese culture as a very, industrious culture and back in the 60s. And then they were trying to talk about East Asian cultures as very smart and Indian cultures, etc. But there's been numerous studies that show that this is not helpful. Actually, Asian Americans, South Asian Americans are not smarter than any other groups. We're not more emotionally stable. And so when there is this kind of expectation that is set, sometimes that can lead to a deeper internalized shame and guilt when you're not kind of aligning with an expectation that maybe society or your family or yourself is expecting. And so then that divide that can kind of sit with you, and that shame and that guilt can lead to more depression and anxiety. I see all too often a lot of Indian folks reach out to me. And like I said, in my own family, I don't know a family that doesn't have mental health, challenges in it. If you find one, let me know. That will be the anomaly. But I will say that like a lot of folks in the South Asian community reach out to me, and they verify this concept, and they're sitting alone with it. And I think that loneliness is really devastating.
Let me just interject, because this is such a rich conversation. It's almost like there's so much. And there's a couple concepts that you all are making me think about. One of them is when we use the term mental health, we're really talking about the expression of our brains, the way that we perceive the world around us, the way we process information and feelings and experiences. And, our mental health essentially is a combination of external and internal influences, our stressors and our positive influences from early childhood, even before birth, but on throughout our lives and ongoing, and our internal experiences, our brain, our body, our physiology, our genetic makeup. All of that comes together to create an expression of mental health. And so we all have mental health. Some people have mental health conditions, just like we all have physical health, and some people have physical health conditions. And, I think in my own background as a half Chinese American who grew up in a predominantly Asian influenced household, it was when I decided to become a psychiatrist, it was very helpful for my father, a Chinese scientist, to understand that there is a science that informs all of what we're learning about mental health. And so, Gila, when you were talking about like even back in the day when culture and families were much more cohesive and supportive, and so even if they didn't understand that it was, let's say, an onset of a mental illness affecting a family member, that they still could provide support. But that's in a way what we mean is the understanding is now scientifically informed, and it's physical and it's psychological. It's both. And in part, that's why this panel of experts is so beautiful, because we're all trained in similar but some complementary ways with both medical, psychological, psychiatry. And I think we're all very integrated in the way that we think about our mental health. So anyway, I just thought I would just throw that in.
Yeah, I think that's such an important point. Like I found, so I did that triple board program. So I'm a pediatrician as well. And people often ask me why I did that. It was a lot to go through. But it was so I could kind of code switch. I knew that it would be helpful for some to hear it in a fashion that's biologically rooted as opposed to psychiatrically rooted. And I'm really happy that these days, I went to medical school and graduated in 2011, and that was my concern at the time. In 2023, though, I'm really happy to see, and especially with program directors like Gila, it is amazing that there are folks from our community that are going into psychiatry, psychology, Dr. Dimple, and like really just like going for it. And I'm in such awe of that, actually, because I was so afraid for so long. Like, I swear to God, until I don't know if my parents even know if I'm a psychiatrist. They're like, he's a doctor. And it's such a stigmatic thing. So I'm glad that you brought that up, because it really helps sometimes people to hear that, hey, there's a biological basis for this, and however you kind of frame that for them, it takes the blow off of it being like some sort of failure.
And also addressing what Zila had said too about like that family dynamic. I think being from the South Asian community, you also know it's not just the individual that you're working with, but also like the family as a unit itself, and being able to provide that support so they can provide that support at home. And while I'm in sessions with my patients, obviously with release of information and getting families in the sessions too, so that way we can work together so they can get additional support at home too.
And to that point, Dimple, I agree that, and to Deep's point, that it feels like a failure whenever there's mental illness that's brought up. And I think as child psychiatrists too, we sort of see that the family unit is so important. And yet, without that understanding and knowledge, it's so easy to perceive that we came here to this country, if they're first generation immigrants, to have a better life for our children. We're giving them far, far beyond what we had. So how can something be wrong? We love them. We care for them. We, have gone the extra 1,000 miles to get them to what we, to a place we didn't have and weren't at. And so how do you say that there is something biologically wrong, rather a failure on your part as a family or parental unit in the health and welfare of your children?
So you came all the way here, did all this, and you're depressed? It's like,
or what do you know about stress?
hey,
That's what I got.
Right. It's like, I learned it all from you, Pop. No, but in terms of that, I think one of the beautiful things about our culture, I'm just gonna be honest about it, just because I know a lot of folks watching, I'm hoping that can relate. And if I say these things out loud, people know me as a pretty candid person. Someone it will make sense to, and hopefully you will feel less alone. But like, I have a little bit of a love-hate relationship with my culture. I love it. I went to India a lot as a kid. I cherish everything about the culture, but there's things that I hate. And I don't use the word hate ever with anything. I actually hate the word hate. But it's such a challenging thing. But when we can integrate peer and professional support, and I think one of the things that one of the most beautiful things that our culture can do is peer support in a way unlike any other. I always say, like, I'm South Indian, so take this with a grain of salt, Dimple, but like Bollywood's in our blood, I know it's a North Indian, phenomenon, but it's in our blood in the sense that I think when I remember my uncle-in-law had made a film called Three Idiots, and I was watching it. This was when I was back in medical school, actually, and and as I'm speaking to a community who understands the word idiot, that sounds very harsh in this country, but in our culture, it just means like fool. Anyway, this film, one of the characters attempts to take their life, and in that film, you could feel palpably, not just in that theater, but I swear, 1 billion hearts just stop for a second, and the ability to give words to people's feelings in a way that's very creative. I think the South Asian community is amongst the most innovative community in the world. Some of the most creative CEOs are in Silicon Valley, 3 out of 5 actually, just counting. No one's counting, but I think that capacity for innovation and creativity amongst our peer networks, combined with our reverence for science, as you mentioned, from we can start having these conversations that start, I think I froze a little bit, but we can start having those conversations that start at home. So part of it is like, how do we talk about this? I think movies, song, dance is part of it. There's always that moment where you're at tears in a Bollywood movie, right? I think that's very intentional.
That is a perfect segue because I wanted to make sure that we get to this topic about how do we engage people in our lives and in your culture, in your families, and in your community. If you're worried about somebody in terms of their mental health or a suicide-related concern, Dimple, let's start with you. How do you find that that you approach that? Really approaching somebody else.
Yeah, no, and just like going off of like that peer support. Back when I experienced my first panic attack in 2009, I knew nobody talking about this. No, none of my friends experienced, or if they did, nobody was talking about it. And so truly feeling alone, but I was so social and outgoing that you would have never known that I was struggling with this. And I hid it for months from people. Showed up to everything, went to classes, did everything like I was expected to do, and no one knew until I finally started telling them. And once I did, I noticed that some of my friends also opened up about their own struggles that they were going through. And that's when I first saw, I'm like, oh, I'm not alone. And then years later, I did create an Instagram page, Mental Health Bhavnas, after my mom, and really started speaking more and more about my experiences, but also of what my mom experienced as well within the community, and not being able to speak about things and was worried about what the community was going to say and felt so shameful for struggling with issues. And as going off of that too, of like, especially wanting to know or even talk to them about paying attention to like 3 main big areas of like, what is their mood like? Are you noticing that like their lack of interest? Are they irritable? Do they have anxiety or depression? But also going into behaviors, what are they doing? Are they using substances? Are they looking for ways to end their life online? Or even talking about it, making passive jokes about it, isolating, sleeping too much or little, appetite, changes in appetite? Even the big one is like, are they giving their possessions away? Are they aggressive or even feeling tired? Are you noticing that change in their behavior from what they were to what they were not? I kept it hidden, and you'll see that too, putting on in front of other people. But also of like how they are talking. Are they making jokes about wanting to end their life, or are they feeling hopeless? Or the big one too is like feeling like a burden on others, or feeling trapped, or that unbearable pain. And so being mindful of seeing all those things, I think, is really important. But I've also seen that shift as time goes on, that there are conversations being happen and so much on social media with the younger generation. And for me, it was really important once I started to put these pieces together that I have that ability to break those generational cycles and being able to start making that change, because that change isn't going to happen overnight. It's going to take time, and it's going to take, I don't know, like even a few different generations, but slowly making the effort. I know that I can't do it alone, but there's so many of us that are doing this work and having those conversations. I think it's really important to even start. But oftentimes, I think there's a lot of pressure from that community, even within the model minority myth. I've worked with individuals like high school students who are in AP classes that often get dismissed of their anxiety or depression gets dismissed, and they have to focus on like their grades and all these things. But that's a group that I like found working clinically that, oh yeah, this also exists in this group as well, not just other kids. And so it's paying attention to seeing what else is out there.
I'd love to share, unless Gila, something was coming to you.
Just very briefly, that I agree that it's often very quiet, and it was just interesting to me that when I was looking at the statistics for South Asians for suicide, there was one study that came out last year from Illinois where 73% of the people who had died by suicide were living in intact families and with friends. Like they never talked about it. And that, to Dimple's point, that there is such a pressure to look okay that you may not pick up on those things. And another thing that I think may be more cultural is, like Deep highlighted, it's so much easier to go the biological model of physical illness that a lot of times they won't talk about mental illness, but they will go to their doctors and talk about having headaches or non-specific complaints as a way of communicating their mental distress, but might not find the courage to actually put it into words that it is really a mental health struggle.
You know, when you were talking, Dimple, I just think about, yeah. So I was like the worst version of everything that you were describing. Like I hid everything from everyone, from my family. So I am dyslexic, and I just like didn't want to be like the dyslexic doctor. Now that I even said that, it's probably going to become a thing. But I was struggling a lot in medical school, and I remember, my father's not doing too well right now at the moment, but I remember, he's a cardiologist, high functioning guy, specializes in the heart. I'm studying hard, and I remember it's those early warning signs that you were kind of alluding to. Everybody should think about triggers, early warning signs, and coping mechanisms. That's what I do with all my patients, including those experiencing homelessness. And we're no different. So my dad, who's a cardiologist, and our family often can kind of, who know us, they know maybe not our triggers, but they can tell our early warning signs. And I wasn't responding to phone calls as much because when you're in this, especially model minority myth, I'm thinking, look, I just want to succeed. I'll advocate later. Okay. Like I don't have time for anyone or anything. Like I'm just going to succeed. I'm going to advocate later. Everything's going to be fine. Working hard here. And I still remember, my dad drove all the way into New York City. And I don't know how he got to the security of the building or whatever. And I just hear pounding on the door. I opened the door and he said, "You know my rule. I just need 2 seconds." And then he left. And he knew intrinsically in our family, at least, that withdrawal, whoa. And it clearly terrified him to the point where he did that. And I always remember that, because that love in our culture is like, that's our fuel. And then it helps us get through it. So like, I didn't disclose to anyone. I'm sitting there, I'm almost failing. Oh my God, and we don't realize this in the medical community. There was actually some very, very devastating news yesterday that we lost a 40-year-old oncologist who had a baby, a husband, to suicide. And in medicine, we lose a doctor a day to suicide, amongst the highest in any industry, 300 to 400 a year. And so we're no different than anybody else if you're high functioning or what have you. And, with the dyslexia came, all those things, depression, anxiety, probably everything in the DSM, but hide.
I want to thank you so much, all of you. I mean, these experiences you're sharing so powerfully and vulnerably. I just want to thank you and make the point that when we go first and when we take that risk to share the hard stuff we've been through, that signals to the people we're sharing with that we won't judge, that we're safe, that we have empathy for painful struggles, that we understand that all human beings go through painful struggles. It's just part of the human condition. And it's not a sign of anything related to weakness, because it's all of us. It's just simply part of being human. But I love that you're talking about your family member, in your case, Deep, your father, Dimple, in your case, you were eventually able to share after you did get therapy. And, Gila, in your work with patients and their parents as, children who have mental health conditions, we underestimate the power we have in each other's lives, even if we don't have technical skills or we don't have to be trained as a mental health professional. Just showing up and saying, I noticed that you don't seem yourself, and I care, and I will be there for you, and helping them find help. Goodness, we are.
Can I just add one little thing while I'm talking? I'm feeling a little sentimental about my father, and I'll say, he's a cardiologist. A little joke to the Indians out there, he always gave me a complex for not being a cardiologist. His heart is, in a little bit of bad shape at the moment. I told him you could have all the greatest surgeons in the world, but they can't fix a broken heart. And I told him I'm working on the latter problem, and we're actually both specialists of the heart. He found some comfort in that. And what I'm doing for him, and what I wish I'd done more for others, and what I wish I had, it sounds simple, and it's exactly what you were saying, Christine, is I think accepting people exactly for who they are, and just conveying that in the smallest forms. Like, I accept you, good and bad. There's nobody out there that's perfect. There's, whether you accomplished whatever you've set in your head or not, that's not what defines you. And when you can see people for exactly who they are, I'm trying to do that for my father now. And that gives a certain comfort and goes against that loneliness, which I think is the comorbid thing that really sits with us and eats at us.
You just mentioned loneliness, and we know that the Surgeon General of the United States has, in recent years, has been really on this mission highlighting the epidemic of loneliness in America. And I've heard in our preparatory conversations, you three talk about how in your culture, the boundaries are permeable. Like there's people are in each other's business. There's a sense of, maybe almost like lacking privacy at times. And yet there can be this suffering in silence that especially Deep and Dimple, you've highlighted your own experiences with. Can you just talk about that that interesting thing of the boundaries and yet the isolation, and what you would want to say to families so that they are not afraid to approach each other?
I think definitely, I'll just jump in with that. I think times have been changing, and I'm noticing more and more teenagers come in with their parents. South Asian teenagers come in for therapy, and it's either been initiated by the school or the child itself to the parents of like, something's going on and I need help. And then, but also one of the biggest parts too, I think I've also noticed with this, is there's a lot more resources available now, and especially with 988 available. And I wish that was around years ago. And being easily able, we did have the suicide prevention hotline, but now it's an easy number to remember, 988. You can call, text, and chat with someone there, and they're available 24/7. And I want to get that out there because that's an easy resource, and you can be anonymous there too.
Yeah, I'll just add to that what I like to say about loneliness. First of all, I have this slide here. I don't know if you see it, but Dr. Vivek Murthy, South Indian, just want to put a plug for my guy. Anyway, 19th and the 21st U.S. Surgeon General. He came back, put him back on the court. Love this guy. He, really is making a point out of the fact that loneliness has the ramifications of smoking 15 cigarettes a day. So just place that kind of like, thought in your head. And I think the work starts out there. It doesn't start in the professional's office. Like, it's important that professionals exist, that mental health literacy starts getting promoted the same way we promote financial literacy, sex ed, et cetera. But the conversations start out there. And I think we shouldn't, I wish I didn't hold back any of those conversations, ask all those questions. You might be surprised what some of the answers are when you just start having these conversations, and loneliness, what it is. I think people are very confused. Think of something that you haven't shared with your mother, you haven't shared with your best friend, you haven't shared with a colleague. That feeling, that's loneliness. It's not when you're surrounded by people. It's when you're surrounded by people and you feel alone. It's not when you're actually alone. So I think it's important to have those conversations.
And I think to that point, that connectedness is just so vital to our existence, regardless. And I think I was reminded of when we were talking about loneliness was when I had a patient die by suicide, and our physician identity, and we have to do obviously the best we can for our patients, and yet that sense of failure and the shame and guilt that comes with the suddenness of a patient dying by suicide. And in my case, it was a young kid. So just the sort of the gravity of that itself, and yet the loneliness and the isolation that you sort of build around yourself with. Am I a terrible clinician? My patient died. It didn't happen to somebody else. Are people going to think I'm good at my job anymore? Or am I even suited to care for other people? And all that sort of self-doubt that goes with it, I think was very illuminating with how quickly you can go down that path and how difficult it is to break out of it and say, this was terrible and I feel awful.
Okay, this is just such an incredible conversation. We're gonna need to wrap up, believe it or not, time has flown by. And I want to give each of you an opportunity, if there was something on your mind that you didn't get the opportunity to say, maybe we can just do a quick closing it out, round robin here. Dimple, maybe I'll start with you if there's anything on your mind, and it's okay if you said everything you wanted to say.
I think I would add in that just remembering that mental health issues are normal, that even if you can see someone's social media or see everything out there, that doesn't mean that these things don't exist. And especially with the younger generation, or when I was during those times as well, struggling, knowing that you're not alone. And there's so many services and resources available. And if you're a college student, check out your local counseling center and you might get low rates of therapy or limited sessions. But knowing that it's better to go talk to someone and just have it checked out. And if it's not a big deal, then, it's okay. But just know that there is help out there if you're feeling anything.
I love that. Gila, how about you?
I just echo everything that was said. I think the fundamental things is to join with the patient and the family, more so as an ally rather than an outsider. And I think that gives us much more buy-in in a culturally sensitive manner, where it feels like not dictating, but let me speak your language in a way that we can all understand and make a plan. And sort of fostering that sense of we judge ourselves far more harshly than anybody else does. And probably, I think, sort of going beyond that might be one of the first steps that we can do as a culture to improve what we do for each other and taking care of ourselves.
Yeah, and I'll just say that I think that I think life is better together. I think our culture is beautiful. As much as I have some pain points with it, we have an innovation amongst ourselves. We're all we got, but we're all we need too in some ways. And what I'm always trying to do, especially younger folks, even older folks, I don't think play therapy is just for kids. I think it's for us all. I like to meet people where they're at, and I like to translate the DSM to whatever. I know in our culture it makes people uncomfortable. Some people like the term, some people don't like the terms. So I always try to work with meeting people where they're at and not expecting all the solutions for one problem to come from one person. So I was trying to reference one study to mention it, but it's a study from Harvard on adult development that the number one factor that helps like success, if we're, that's on the minds of anybody who's listening, because I know no matter what we say, you still want to, get a 4.0 GPA and all that stuff. But it's warm relationships. Warm relationships. It's not intelligence. It's not attractiveness. It's not socioeconomic status. It's warm relationships. So find warm relationships. They're out there. There's people you haven't even met yet who can change your life, and you can change their life.
That's so beautiful. I've learned so much from all of you, and you really brought it home for me that it's the barriers sometimes in our culture, but sometimes in our own mindset that keep us from really optimizing our lives and living and connecting, and can even be life-threatening if we don't allow ourselves to open up and to seek help when we need it. And Dimple, thank you for mentioning 988. It is a resource that's available 24/7 for anyone in the country. And even if you're not the one who is struggling, if you are the one trying to help your loved one, you can call it also to get guidance. So I just really want to thank these incredible 3 individuals, our panelists, Gila, Dimple, and Deepak, for this wonderful discussion today. I've really appreciated your willingness to share, your generosity, how vulnerable you've been, and really willing to speak about your own professional and deeply personal experiences. So for those of you who've been with us today, watching and hopefully participating in the chat, we really appreciate you joining us. And we did this for you, and want this to provide you with some tips and advice, but even more importantly, a sense of connection and that you are not alone. This is, again, the latest in our ongoing series, Elevating Voices for Long-Lasting Change, which is AFSP's Diversity, Equity, and Inclusion Town Hall. We really hope that it's helped to elevate an understanding and an empathy for this incredible range of experiences that we've heard about. So thank you so much to all of you. Be well.
Yay.